just want to thank Laura again for a great presentation. Great way to start off the day. And if you haven't picked up your goodie bag yet, your little black bag, there's a copy of Laura's book in there, and she will be around today. She's able to sign books, or if you want to connect with her during one of our breaks or at lunchtime, she'll be here for that. My name is Angie Malone, and I'd like to welcome you to Molloy University. And I'm going to introduce our next panel, collaboration, why it's important and how to do it. So in this session, our panel is going to discuss the power of collaboration, strategic alliances, empowering your leadership, and creating lasting impact. So I'd like to introduce Dr. Sherry Radowitz, who
we're all friends now, right?
She's our Senior Director of Grants and Sponsor Programs at Molloy. Sol Marie Alfonso-Jones is Program Director of Long Island Community Foundation. And Kathleen Rivera is the Executive Director and CEO of North Shore Child and Family Guidance Center.
I just thought I would take a few minutes before our interactional panel discussion around collaboration to just go over some of the principles. I was doing some reading and thinking about my history with collaboration, my feelings about collaboration, and what are some of the factors that come into play. I remember, as I mentioned earlier when I did my intro, I worked in nonprofit for many years, and there was a lot of questions around collaboration in those times. You know, it was issues of power. How do people make decisions? Who's in charge? Am I giving anything over if I collaborate? What do you do with conflict? And then, of course, we had the fear of mergers. What if nonprofits were considering merging with one another? What would that look like? And nonprofit survival. So those were some of the questions that came up through the years in the history of my work in the nonprofit world, where it wasn't so easy and obvious for collaboration to take place. So I took a look at some of the factors and the way I look at it today, my experience with it, my feeling about it, what some of the values of collaboration. So collaboration is bringing differing perspectives. Complicated issues can benefit from being examined from multiple perspectives. And then what if you can't figure something out on your own? Or you're missing something that's essential to what you want to do? Can somebody else, put that puzzle piece together for you, and you can have, they always say the sum is greater than the parts, and sometimes it is. Knowledge sharing and blended solutions. When partnering with other organizations, each group brings thoughts and experiences that can be helpful for everyone. Often, and so that perspective, that's exciting, that's invigorating. And then reduction of silos. How many of you may work in larger organizations, like let's say Kathy's agency, where people aren't even collaborating with each other necessarily? You find that I work for a university, right? And somebody will say, we have that program? We do that? I didn't know that. I run into that all the time. Now, fortunately, in my role as running the grants office, I kind of have to know what's going on all over. But we will blend people together sometimes. Like, I didn't even know who you are. I've never met you before, and you work for the same entity. So it's kind of interesting how that works. When you're in a small group, you're not going to necessarily have the silos. But other than that, different departments, different programs, different services, even people who work in agencies that have multiple locations. So this can break down silos, because let's face it, work can be lonely and exhausting, and collaborative work can provide new support systems. And then there's creativity and innovation. I love talking to people, coming together with things in that kind of shared vision, bringing together organizations that haven't traditionally worked together. Where can you find new allies and new ways of thinking? I know book fairies for such a long time, and I remember when you guys got started. But, look how many partnerships you've developed, because your work works off of the partnerships you have with others. And that's what happens with a lot of what we do. And then the increase in stakeholders and strategic alliances in the broader appeal. So your organization has champions. If you were asked that you have to get support letters or letters of collaboration, maybe you can get 5. But maybe if you partner with someone else, they can bring their 10. And now you've got 15 to go into. And maybe you're trying to get a grant that requires that. And now you're coming in with many more stakeholders and many more connections that maybe you haven't had before. And professional development. Can collaboration help you grow as a professional? You know, what about new opportunities and networks? You know, maybe you're looking to do something else. And look what it opens up to you as a leader, as a new way of approaching your own career goals. And then there's efficiency and productivity and a reduction in duplication. How can collaboration make us more efficient and reduce duplication? Because I know from a funding perspective, that's extremely important. You know, funders don't like when you write a proposal and say you're the only one that's doing something, when in fact, 10 blocks away, someone else is doing something very similar. So that's the funder due diligence process. I'll let Marie talk to you about some of that. And then positive outcomes. Will collaboration strengthen your operations because you have more resources? Will you have a better chance of funding? And then, you know, for example, I was saying I submitted a grant yesterday. The grant I submitted yesterday was a National Science Foundation grant that was an alliance model. You could only submit this proposal in alliance with others. And so some of them are just strictly done by a collaborative model and an expectation of collaborative partners. Now, if you're going into, let's say you're working on grants and you're going into a grant collaboration, what pieces of information should be identified? So when you're thinking of collaboration and looking at what that entails, so you know, you have to identify who your partners are going to be. And also something about partnerships, they grow. You know, just because you've started with 1 or 2, maybe they're bringing some partners to the table and all of a sudden there's many more. You have to understand who's responsible for what. Define decision-making process, determination of expected outcomes, and how the funds will be allocated and managed. What we do is always these task charts. Who's responsible for what, you know, and then what's called in government grants is scope of work. What is the scope of work of your collaborative partners? So we have had at Molloy many grants, fortunately, and we've had many collaborative grants. And I always look in every time I write one, look for the collaborative elements. That's extremely important to me as a person, as a professional, as a leader, and as someone who kind of, I guess, has my pulse on what I think makes something strong and rich and successful. In approaching funders and even in approaching the work that we do as an institution. You know, a university can kind of be in a pivotal role to bring people together. You know, look, you all came here today. You know, I mean, we're hosting with the resource group, but you also came here today. You know, it's a place where people can feel comfortable to convene, to talk, to share, to grow, hopefully. We're in the business of educating. We're in the business of learning. So that's just some of the things that I highlighted. And I just wanted to, before I turn the discussion over to my co-presenters, I wanted to just mention the Mother Cabrini Health Foundation grant again, because I like to use that as an unbelievable model of collaboration. I was just talking to Marie about this. Not everyone thinks about their funder as their collaborative partner. I do. Okay, so when you approach grants and you approach funders, you think about what that relationship is like. They are really a funding partner. It's the grantor-grantee relationship. My government grants, we have a relationship with the program officers. We run into a problem, we reach out, we ask, we talk. How do we handle this? What do we do? We ran into a problem with one of our federal grants. We had a flood in our facility that was doing a research project. Got in touch with my program officer. Can we extend our contract? You know, and I think that's what the relationship is, because funders, you know, funders are only successful as their grantees are successful, because that's the nature of this partnership. With the Mother Cabrini Health Foundation, I found, you know, very real. I've been doing this a long time. I guess I'd go for 45 years in the grants world. But anyway, it's hard to meet a foundation like the Mother Cabrini Health Foundation. I feel like they have just been angels to us. To be able to come into our sphere and to be able to enable us to do so many things we wanted to do. And they come to it with open arms, with support, with kindness, with respect. It's everything that you hope this relationship will entail. Now, when they reached out to us in the summer of 2020, they wanted to find something that they could partner with us about. And I thought, we talked a lot about different things, and we decided, well, we have, of course, the largest school of nursing in the country. And so we talked about starting a mobile clinic, bringing healthcare to communities that can't access it. And then we did this, and guess what? In the heart of a pandemic. We had to get a van, we had to equip it, we had to figure out how we're going to launch something. So we met with them in the summer of 2020, and we had our mobile clinic on the road in the spring of 21, and that was pretty amazing. Grant started in January, and we were ready to go in the spring. So why do I bring that up too? Because we talked about silos, we talked about internal collaborations. Well, I thought, well, what if we make the mobile clinic more than just nursing? What if we bring in speech language pathology? What if we bring in clinical mental health counseling? What if we bring in social work? What if we bring in education? What if we bring in music therapy? What if we bring in languages and cultures to help translate things into Spanish? What if we bring in our School of Business as things expanded, and continuing education? And of course, I work in the Office of Advancement, and on and on and on. This is the internal collaboration. So now when we go out to visit communities, we are not only doing blood pressure checks, we're doing hearing evaluations. We're doing music therapy activities to reduce stress. We're talking to groups of people. Our education students are also, working with students in schools. It goes on and on and on how you can do amazing things. We go to senior centers and do groups. Our partnerships with the community sector, God, what Angie, about 100 different community locations and so on. So it's been quite a whirlwind. So in year one, we did the mobile clinic in year 1, year 2. Year 3, they came back to us and said, we want to give Molloy a much larger grant. What funder tells you they want to come to you? We want to give you a much larger grant. I loved every minute of it. Anyway. Oh, Mark, really? What's that large grant going to look like? How much is it? Anyway, so it allowed us to expand beyond the mobile clinic and to enhance clinical services. So when we do screenings, we now go back to the community and we could do more enhanced services. More clinical work with patients that need us. In addition to that, we started this capacity building, which is you're kind of well benefiting by today. It's the nonprofit capacity building component of its art. So we have Pillar 1, mobile clinic, Pillar 2, enhanced clinical services, Pillar 3 is nonprofit capacity building, which has been workshops every month that many people, I don't know how many of you here have been participating, but some of you certainly have. We've been doing the introduction, we did hybrid, we've been doing the rest by Zoom. And then we're also now doing our capstone model where we are working with nonprofits and giving them a whole range of resources to help tackle different problems. Brian O'Neill is from our School of Business, and he's been an amazing partner in getting to work in just pulling that part together. And the 4th pillar is healthcare workforce development. How are we helping people? The healthcare field is in dire need of employees, and people need to have good careers. People we're reaching in the community that have hard times, and we're trying to make that match. In addition to all of that work, before we move on to the rest of this, I just want to share something that I thought was that I kind of was really pretty proud of. So we get a lot of feedback from students because the students are really the ones staffing the clinics as we go out with faculty supervision. So the feedback to us has been really remarkable. So think about this. So So through student feedback, we're seeing the value of students interacting across disciplines, along with their faculty supervisors learning from each other, collaboration. They are practicing what they learn in their classes. They're helping people of all ages and stages. They are providing patient education along with services. They are inspired by people who are interested in making positive lifestyle changes. They feel valued and appreciated. Many have found the experience life-changing as they begin to see themselves continuing this kind of work after graduation. So what I loved about this is, you know, what if we were able to blend scholarships for our students and help them? They can go out and do the work and see firsthand what it's like to work in communities where maybe they're never going to get that opportunity to really be hands-on in communities and to see what this work is all about. And to work with each other and to learn from each other, you know, and to see, you know, let's say one of our nursing faculty does CPR, hands-on, the hands-on CPR, it's called hands-on, hands-off.
Hands only now.
Hands only, thank you. I'm sorry, I only slept 3 hours last night. I apologize. Hands only CPR, which is much safer way of doing CPR. And we take that out and teach communities how to do it. We do all this heart healthy work at Molloy. And so I point the Cabrini grant out is because we go into communities, we've been to about 100 different locations. We're partnering with schools, libraries, healthcare providers, homeless facilities, churches, food pantries, range of nonprofits, and we're providing these amazing internship experiences. So what I want to say about this is that if you think big, you know, or dream big or whatever it is, just think about the exponential value of what this collaborative model is doing. It's brought us together as a university. It's brought us together with more of our community partners. It's helped our community partners access resources that, you know, maybe we can help them grow their abilities to get. So I think it's just a perfect example of what a collaborative model, successful collaborative will be. And of course, a relationship with the funder. So since all funders are looking for great impact with investments, with their investments, I'd like to you know, turn the discussion now to a longtime friend and colleague, Marie, from the Long Island Community Foundation. Because as a community foundation, they also are very, very invested and integrated into the Long Island community. So Marie, can you talk a little bit about that? And also, why is not-for-profit collaboration important to funders?
Absolutely. Do you want me to stand up? Maybe it's easier.
I think it's,
Yeah,
can't do
okay.
as much.
First of all, I want to thank Molloy. I want to thank my long-standing friend, Sherry, and just this entire institution for all the work that you've done. It's been a real benefit of mine to partner with Molloy, both as a foundation executive as well as in my time in nonprofit. Which is the majority of my work career, I still say. I've only been in philanthropy 14 years. I want to start also by shouting out the nonprofits in this room that, you know, that we support and we currently support and hopefully will support in the future. If you don't know about the Long Island Community Foundation, and Judy from Pro Bono Partnership, who recently did a workshop for our grantees at the Long Island Community Foundation. How many of you know about the Community Foundation? Okay, so I'm not going to spend a lot of time talking to you about it, but I do want to say that what Sherry said is really important. And when we were talking about partnerships and collaborations, I thought and she said, you know, it really stems with the partnership between, you know, the one-on-one, you know, the funder and the nonprofit. And I thought, you know what, that's absolutely right. Like in my mind, I was thinking, oh, nonprofit to nonprofit, you know, funder to funder. But that's absolutely right. And what she said about the relationship between the funder and the nonprofit, helping the foundation reach their goals is absolutely right. And so that then brought me to the preparation that Laura was talking about, which is really so important, right? Understanding what drives that particular foundation. And also understanding that that foundation, in order to meet that mission and goal relies on you. It relies on the nonprofit sector, and that this is a partnership. And, I know that our sector, philanthropy, doesn't always present that way. And I'm telling you that your power is that we can't do our job without you doing your job. And so this whole confidence, walking in with confidence, is very true, because we are a partnership to meet a particular goal. The more that you know about how we operate and what is, important to us, which can be seen in terms of what grants we've made, how much we've been able to make, what geographic areas matter to us, then that partnership can, sorry, should have gotten my water. Then that partnership can be really, solidified, because then we're talking as peers, which we should be always talking as. We're in the role, we have the benefit to be able to allocate resources to the very issues and causes, that are impacting our public good, which matter to us. And you're the most important, as far as we're concerned at the Community Foundation, and I do believe with all of my colleagues as well, that we are very clear that the nonprofit sector is the most important within this relationship between funder and nonprofit. So, thank you. So, just, always remember that the Community Foundation is made up of staff and board that are from Long Island, from Nassau and Suffolk counties. So a community foundation typically is a little bit different than maybe another, like a Mother Cabrini, although we have a great program officer who's from Long Island, so he knows a little bit more of the landscape. But that's not always the case. With the Community Foundation, it's our job to understand the issues, and we find that out through our partnerships with you all, but also because of our lived experience here. Your Community Foundation should be really accessible, and whether or not we can or cannot support the work, because everybody has their priorities and such, it's important for you to develop a relationship and a partnership with your Community Foundation, because we have access to other resources that could be helpful to you. And that could be introductions to other funders that may support your work that we don't. So, the Community Foundation is a really important place to go. With respect to why, what we look for, why partnerships are important. So I said to you that I have a nonprofit background. I do. And because of that, I've spent 12 years in the city working in a nonprofit, and then I came out here and spent an additional 6 years working in nonprofits before I came to LICF. And, I understand very clearly what the struggles are of nonprofits, and to Sherry's point, when she was talking about how collaborations were such a bad word back in the day because it felt like, mergers, et cetera, et cetera. Now, I believe that because of the intensity, the acknowledgement that these issues that we're trying to work on are so complex and are not linear, right? There's not one way to solve an issue. And when a person is experiencing a situation, or when we're trying to address an issue like climate change, there's no one way of doing it. That said, nonprofits can't be everything to everybody, right? So the partnership is really important to be able, not only from the economies of scale that Laura talked about, which is really, really important, or to improve, your ability to get something done, whether that's advocate for an issue and get legislation passed, or whether that is to, serve the needs of the homeless population, not just by housing them, but also by putting them on a track to employment and ending that cycle. After school programs, et cetera. One organization can't do all of that, but in a partnership that is organic, or a collaboration that is organic, that makes sense for the nonprofit, then you can expand your services, but more importantly, your impact of what it is that we're trying to do in these complex issues, right? The other thing is building trust, which is another really important thing. For a smaller nonprofit that may not have the same brand recognition as a larger nonprofit, where it makes sense, and those partnerships and collaborations can help that smaller nonprofit build that credibility. Let's say even with a funder, right? There's a tiny little nonprofit. We don't really know that nonprofit. What's most important to me is that the clients that they say they serve, are validating their existence, but also, and their work, but also it is helpful to see when a small organization is partnering with a larger organization to help them build their capacity to do the work that they're trying to do. And for larger nonprofits, oftentimes I'll see, like, if I see a New York City large nonprofit coming to Long Island to do some work in X community, but they're not able to articulate clearly who their partner is. And by partner, I don't mean just that this is because we're a community foundation. It's not just having a partnership. It's also, if you're asking for grants and you're expecting something from the local partner, I need to see that there is some money going to that local partner also. So, and that can build credibility for the larger organization, that they have relationships with a Long Island-based organization. Or if an organization wants to be more culturally diverse or, address an issue, it's very helpful for them to, partner with an organization that has that cultural competence. So those type of partnerships and collaborations can build credibility that is important for me when I'm reviewing a proposal and the project before. Again, I'll say that, that there does need to be a clear value proposition, right? What is it? What's in it for the two organizations? How are they improving their services? How are they addressing the issue more holistically? But again, the most important part of it is that it is an organic, natural, way of moving forward on a particular issue, because then that can be sustained. Then there's, as opposed to it being imposed, or they're feeling like you have to do this because of, a particular proposal says that you have to do it. Like, that's not the best type of collaboration. And, so for me, collaborations, I will say again, are really useful when they are helping an organization, take it to the next level, wherever they are and what that next level means. And as long as the partners, there's clarity about how that's moving forward, and, and both partners are, as I said, there's a value in it for both partners and the clients that they serve, then we are really interested in that. And I don't know if you want me to talk about a couple of examples.
Well,
or
I'm gonna come back to you, okay? Kathy has to catch a plane.
Yes.
So I'm gonna let Kathy speak, and then I do have another question about funders collaborating to support issues and working together. So, but let me let Kathy on, because she has to get on a plane in Newark.
I'm going to Jamaica, so it's not a bad thing. Don't feel sorry. My sister-in-law's 50th birthday. So
Yes, I know. We had a whole talk about this, and she's got to make this plane Newark. I'm like, oh my God, make me nervous. But anyway, I just wanted to say one thing about North Shore Child and Family Guidance. I got involved with this agency so many years ago, talk about collaboration.
Right.
They formed an early childhood advisory committee. Oh my God, so many years ago. And I joined that, and that's how I partnered on collaborative efforts with North Shore, and became very good friends with Sandy Walkoff, who's since retired, who's associated with that agency for so long. So I reached out to Kathy on the recommendation really of Kellyanne, as who would be a good partner to bring on. And I love meeting you, and I love reconnecting with the agency. So
Absolutely.
I asked Kathy if she could give an example of a successful collaboration with another nonprofit, and also one with the private sector. So that's what she'll focus on.
So I just want to say thank you again for this opportunity. It's the first time I've ever attended this event, so it's really fun and lovely. There is on the table some information about our organization. show of hands, how many of you have ever heard of North Shore Child and Family Guidance Center?
Yay.
I should take a picture of this and send it to my board. Job security for me. Okay, so I actually want to give two examples, one of sort of the private sector and one of the nonprofit world, so to speak. One thing I do want to say is I just want to kind of walk you through because I think it bears repeating. You've been hearing this throughout the morning from Laura and from my colleagues. I want to just give you a sense of when I give you these examples, what went into it, because this is a leadership conference and what you need to think about as a leader when you do this. First and foremost, know your why. Right? Why are you asking anybody for anything? Why do you want to partner with someone? Is it to fill in a gap in service? Is it to get your brand out there? Is it because you need funding, right? Whatever that is. My other recommendation would be to, and this is a little bit more tactical, if it's not in your strategic plan, it should always be in your strategic plan, right? You should always be thinking about, right, whether it's a 3-year strategic plan or 5-year, what does collaboration look like for you? How are you going to do it? How do you want to increase that? And if it's not in there for whatever reason, you have to ask yourself why. It should be in there is my point. So another thing is obviously aligning yourself with partners that have the same vision, mission, and core values, right? Because the reality is not only is there positive branding, but there's a little bit of risk sometimes, right? Sometimes you may partner yourself with someone that we live in a very litigious world, in a political world. It's not as desirable. You on who you want to connect yourself with, especially sometimes in the private sector, right? Whether it's a financial institution, whether it's a legal institution, marketing institution, what have you. We've been hearing a lot about fostering relationships and building trust. One thing is when you're building connections, you've got to cultivate that relationship. It's not a one and done, right? And sometimes, I know Laura was talking about this, you know, sometimes people may bow out, and as my development person always says, no is no right now. So you always have to make sure that you're cultivating that, but you also want to align yourself with those who have passion, the same passion as you, right? And I've heard that word this morning. Another thing is leaders, don't forget when you're collaborating, check your egos at the door. There is going to be a power differential. You may, if you are the primary person, and let's say you're the fiscal conduit for a big grant and you're working with someone else, right? You may hold more of that power, or vice versa. Be aware of that, be conscious of it, be clear of it, have discussions about it, do check-ins about it. Because when you don't do that, that can be a really big pitfall. Also know your bandwidth. No, don't say yes to everything. Don't go for every shiny object on the floor, right? Sometimes we get so attracted to the money and the dollars that are behind that grant or behind that collaborative partnership. But all that is being asked of us if we partner is way too grand. And we may find ourselves in a pitfall, not showing the outcomes, not having the infrastructure to show the data to tell the story. So just keep in mind about that. And then just really understand what your business process is. I think Laura touched upon this, you know, develop a decision matrix. If you are going to partner with someone, what do you want it to be? Does it have to be formal? Do you need your legal team in there to look at that? Or does it need to be a little bit more informal? Like we partner with book fairies, right? We don't have well, maybe I shouldn't say that. We don't have a BAA, we don't have an MOU, but we have an understanding that literacy, right, is a big thing. We work with we're a children's mental health organization, and we know that when children don't have an education, they don't have the same access into adulthood, and we know that systemically, right, they will struggle. Their emotional well-being will be challenged, and financially, and all these other pieces. Do you want it to be project-based? Do you want it to be time limited? And lastly, and this will start to move me into the example, this way, as with Kellyanne saying. I had to get my steps in anyway. So the other thing too is put your board to work, and that'll segue me into the example of the private sector. So put your board to work. Start looking at their relationship capital. Ask about who they know, what they know, right? And start to see where is their alignment in our mission in that particular private sector, right? If it's in the private sector, where do we intersect with them? So the example I want to give in terms of the private sector is we had a board member who worked for PSCG Long Island. He's no longer there. And he was a newer board member and he was like, I work with them. I don't know what they could do for you. They're an energy company. We're children's mental health. I don't know where the dotted lines are. And so we said, okay, well, is there money that they could give us? You know, do you think they'd be interested in us? And so, you know, we started to flesh that out and we realized, well, look, you know, we, as an organization have a plethora of services, but we also have an aging infrastructure, capital infrastructure. Our buildings were like falling apart, right? Not really. I mean, it's still safe to send kids there. Anyone who's listening, scratch that. No, but we needed a new roof. We needed a new HVAC system. You know, you can't, you know, setting conditions are real. You can't have a child having mental health services and they're sweating, right? So we said to ourselves, oh, you know, like how do we make this pitch? What do we do? Here we have an inn with PSCG Long Island. We have this need. How do we prepare ourselves for this, right? And our board member was like, I'm not really sure, but I can get you a meeting. So we thought about this and we said, well, you know, like, look, climate change is real. And by becoming more energy efficient, right, that is going to make a difference. What did we know as it related to mental health? Kids were coming in saying, and this is true, I don't want to have children. There's not going to be a future. This earth isn't even going to be here. Why do I care about having children in the future, right? And their anxiety and depression through the roof, right? And so what do we know when those things happen, when you feel out of control, you take control, right? And so one of the things that we did when we met and had our meeting with them is pitch this idea of, you know, going green, having an energy efficient domain, right, that we can actually share with the young kids that are coming here and saying, look, you know, we get that the world, you know, is unsettled, right? Which we are trying to find sort of make sense in an unstable world. And we get that and we understand that how, you know, how that sort of affects your mental health and well-being. And so when we met with PSCG Long Island, we explained that, we explained the work we would do, and we explained what our need was, and we explained how they would be making a change and a community impact by supporting us and sort of being able to support kids sort of peripherally, if you will. And they bought it. Right. You know, you know, they talked a lot about, you know, the funding that's there for it, how they work with a lot of partners that can do this. And so lo and behold, we have a new HVAC system. I'm working on my roof next. Also, I'd actually like to give Tommy D, because this is not a finished product yet in the private sector. It's with the financial institution. Tommy D introduced me to Jovia, right? Financial services, right? They do financial services in the community. And so what do we know? We work with a lot of families that have the cognitive burden of poverty, right? When you have housing insecurity, when you have food instability, the mental well-being of a family and intergenerational trauma is compromised. Right. So we decided to pair up with Jovia Financial to say, look, you know, building intergenerational wealth impacts mental health. So can we work with you and have you do financial literacy workshops for a lot of our families? We have undocumented families. We have families where, you know, they don't speak English. They're scared. They don't know what questions to ask. Can we have you bring your people into our site to have trainings on that? And so while we're not in the business of doing financial services, we're now getting the support from Jovia, right? And then of course we invite them to all our sites and we're like, oh, can you be our sponsor too? Great, right? We sneak that in there. So those are just an example in terms of the private sector. In terms, and I'm just sorry, in terms of the nonprofit, I just actually want to give one quick example of a school. So we are not, right? It's the example of going from ineligible to eligible, right? Sometimes you look at a grant and you go, damn, you know, I'm ineligible, right? I'm looking at this, I just can't do it, but it really appeals and aligns with what we do. So Hempstead School District got a huge school-based mental health grant, right? Lots of money, really big ask, right? They were tasked to do quite a few things, right? Build a community resource, whatever. Long story short is we said, look, we've got to get in there. We know that early prevention, early detection and intervention helps kids, right? But not everybody knows about us and not everybody wants to talk about mental health because of the stigma. So we approached Hempstead and said, look, do you have a need for us? Maybe some training, maybe just want to know that we're here and make a referral. And as we sat down and started to talk with them, and we said, could you share, like, all that's you're tasked with this grant? Are you willing to share the work plan? We found that we were able to get in there and provide a lot of professional development for staff. We were able to provide clinical workshops for students and parenting workshops. And they became the fiscal conduit, and we, 150,000 is now in our pockets to be able to provide this training. We don't have the administrative burden of filling out outcomes or anything like that, right? We were able to funnel the data to them. They will put that all together and respond to their funders. So those are just some really simple examples of, it doesn't have to be an all or nothing. And sometimes the little breadcrumbs that you make the bigger difference. So.
Speaking out here in about 3 minutes, but what I love about those examples is it really tied together programmatic sharing, but also there was a monetary benefit, as we have to think in terms of our survival as nonprofits, is how do we think about that? And I always educate, because I do a lot of proposal writing training and management training for nonprofits, is if you're not ready to get a grant on your own, can you be a partner of someone else's? And I think that's important. I mean, they obviously can work on both levels, but can you be a sub-award of a larger grant? Can you break in that way? I think you always have to think about, how can you break into it? In what way will these partnerships benefit, both programmatically and also financially? So I thank you, because I know you're leaving us in about 2 minutes. And have a successful trip.
Well, thank you. I can take a question, a quick question.
Okay, let's take a question for Kathy, and then I do have one more for Somri before we move on to the next group.
Oh, yes.
Anybody have a question?
So I'm really curious about how you go into structuring the operations of these kinds of partnerships. You briefly touched on the business associates agreement. But again, how do I verify how that other organization is protecting donor data privacy? I mean, who's getting the data? How are we collaborating on it?
Let me just say something about the structures of some of these, because we do so many of them. So I'm so glad you brought that up. It has a lot to do with if let's say you go into a sub-award agreement with another entity. There's an agreement, there's a legal form that gets filled out about how to handle a lot of that. We have a compliance office at Molloy. They review all of that, whether we are one or the other.
But how does that work in a small community-based
There's-
organization
okay,
that
so
doesn't have a
There's
compliance?
MOUs, memorandums of understanding, and that's kind of a little bit more of the informal structure, but yet it's still formal, where you outline what you will do, you outline what they will do, and you have different rules of what people. We've had them with school districts. We have a state grant where we work with 9 different school districts. Everyone fills out an MOU about what our responsibilities are on those sides. So it's done like through agreements, it's done through more formalized agreements, but you always should have one. Informal collaborations, you don't need that. It's just kind of like a respect. But when you go into things that involve funding or data or sharing of information, I think it's really important to have that. And I think if you have counsel or you have access to counsel to help craft some of those agreements, that's a really important thing to do. I don't know if you want to.
No, I think you said it best. Shout out to pro bonoship, right? Pro bono
Yes,
partnership in
yes.
the room. They provide legal services, because I think, going back to what Sherry said, there are times that you want to make sure from a legal standpoint, you are covered as a nonprofit for liability and a plethora of things. And when in doubt, just ask, right? Your legal team, if you're a small nonprofit like us, we don't have a legal team, we outsource that. So maybe to pro bono, check in with them as well. If you don't know and you're not sure, ask.
Yes, exactly. Anyone else? Okay, so
Thank you so much, everyone.
our final question goes to Sol Marie, and I thought this was an important one to kind of leave you with. Not every funder has access to millions and millions and millions of dollars to distribute. And our Long Island funders, I was part of the Long Island Funders Exchange many years ago when I worked for United Way. they don't always have all of the resources to support everything they'd like to support. So, Somri, can you talk about how funders have come together on causes? Because Superstorm Sandy was one that I remember getting a grant from that collaborative. What are some of the other ways funders work together to bring more resources to the region?
Yeah, no, it's a really great question. So, foundations like ours that are smaller in nature really benefit from these collaborations with other funders because it enables us, just like the same exact list of things that we shared with you all about why it's beneficial for nonprofits often to, to think about that, to think about partnerships and collaborations. It's the same reason for foundations. So we have been really successful at bringing other funders from other parts of, of other parts of the state to focus on increasing investment on Long Island. We do not have, I don't have to tell you this, Long Island does not have a very hefty philanthropic footprint here, right? And it's challenging because we're the second largest region, and I don't have to tell you again, in the state. And our issues, the boundaries between Long Island and New York City, they're man-made. Like, our issues are exactly like their issues, except we have a lot less philanthropy and a lot less infrastructure, like we, in place, social safety net infrastructure. And that is not because our nonprofits are not amazing. It's just because that's, our region was created differently. So for us, it's really important to work in partnership for a couple of reasons. One is to let outside funders know about our region, increase their investments. We work really closely with Mother Cabrini to help them understand New York Health Foundation and others, to increase not only their knowledge base, but also their investments and their partnerships with other nonprofits. We did that during emergencies like Sandy, like 9/11, COVID. We also have done that to address really thorny issues that no one foundation can solve by themselves, right? I don't care how big you are. So for example, we have a fund around racial equity and economic equity focused on Black communities that have been historically under-resourced and marginalized in this region. And that's, that is the foundation of that was reports that we were able to produce and then share with these funders and say, Long Island is inequitable and we need to do something about it. But LICF can't do that with our $25,000 grant. So let's do this together. And in 3 years, we've been able to raise 1.5 million, award 1.1 million for Black-led organizations. And that's thank you. And thank you all, for the work that you do. And we have done those type. We have another one for our water quality here. So we've, partnered with 12 different foundations, Connecticut, and, and we focus on the Long Island Sound. So Connecticut, New York City, Long Island to raise funding to be able to make sure that our water is, protected. It's an important part of our economy. It's an important part of our recreation here in the region. And so we have, through that partnership, we've been able to, we funded a tool that that all of the areas use to monitor water quality and to improve water quality around using the same parameters. And that tool was so valuable to improving, how we're protecting our water quality, that the EPA is funding it 100%. So we no longer have to fund that. Now we can focus on something else. But these are the things that would never happen if LICF was doing it, alone. Unaccompanied immigrant children, that was a big issue, back in 2014. Our region was not prepared for it at all. And we have a similar situation that's coming down the pike with newcomers now. And so alone, we could do nothing, but in partnership with other foundations, we were able to put money into the hands of legal service providers that have, really given a great pathway to many of these children, and also to educators to help them develop tools to receive these children and these families in a more welcoming way. So the power of these foundation collaboratives, we do them a lot because we're trying to bring more money to the field and more attention to Long Island.